again, a warm welcome to those of you who've just joined us and those who took part in this morning's session. My name is Carla Sampiris, and I'm delighted to be introducing the second of our keynote speakers, Mr. Angelo Fick, whose talk is entitled Talking the Line, Queuing for Health and Social Expression of the Alternative Social Compact in Everyday Life. I have had the privilege of knowing Angelo for many years, and he is currently the Director of Research at our Socioeconomic Research Institute, or ASRI, in Johannesburg. Before joining ASRI, however, he spent nearly half a decade as a resident current affairs and news analyst in the broadcast sector in South Africa, and he continues to give political commentary across various broadcast platforms across the African continent and for a variety of media outlets. For 2 decades, he taught across a variety of disciplines in the humanities and the applied sciences in universities in South Africa and Europe, including the departments of English at the University of Cape Town, the School of Journalism and Media Studies at the university currently known as Rhodes, the Center for Science Access at the University of KwaZulu-Natal, and the Faculty of Engineering and the Built Environment at the University of the Witwatersrand in Johannesburg. So Angelo has also held a number of fellowships, including the UNESCO Fellowship at the Center for Women's Studies at Utrecht University in the Netherlands, and his research is informed by critical race theory, feminism, colonial discourse theory, and post-structuralism. Angelo, in many ways, has been doing medical and health humanities in terms of, I think, the health of educating and critical literacy long before the term or idea was even kind of conceived of here. So we're very delighted to have you here. Thank you very much for taking time to be here. I know you're in the midst of life transition, so I appreciate you finding the space to be with us this morning. Thank you, Angelo.
Thank you, Carla. And I won't take more time, so you will still run on time once I'm done talking, because my position will be to give the talk and then take questions if necessary. So the talk is called Talking the Line, and there would have been brackets of the kind that Anglophone post-structuralist analyses of postmodernism used to make so fashionable in the wake of mid and late 20th century French philosophy. It would have been walk or talking in the line, talking on the line. I might even have used a virgule or an oblique, but I chose not to because I thought I'm too old. We are too old. This century is far too old for us to continue to play those linguistic games. But that lack of division of the bracket or the oblique was also going to, or the oblique or the brackets were also going to be part of signaling the division that we have, because South Africa is a country of divisions based on inequalities. Those inequalities are inequalities of access to resources. These are both material and social, that are based on economic class, language, gender, sexuality, region, urbanity or rurality, education, and what used to be called race. But it is also a society of constant public contestation about those inequalities and the inequities that they give rise to. There have been tens of thousands of community protests in the last 27 years of post-apartheid South Africa. Many of them, I think, labeled incorrectly as service delivery protests, others reported on and re-articulated by so-called reliable sources as criminality. So when one looks at South Africa, and particularly in terms of healthcare, it's a picture of inequity and inequality between the private and the public sector, between the haves and have-nots, between those who can afford and those who can't afford, between people who live in cities where there are clinics and people who live in rural areas where they may not have it. It's a story of corruption and failure. It's a story of underfunding and overworking, of underpaid and over supervised, of overmanaged, of micromanaged. And several people in this conference at the moment can attest to some of that, whether they're teaching in schools of medicine, whether they're working as nursing or doctoral staff or medical staff, whether they're working in the administration of the politics of healthcare provision in South Africa, or whether they've engaged that or been forced to engage it, or whether people like me and some other people in the room who may have just been on the receiving end of healthcare or at the requesting end of healthcare. We would then wonder, where does joy fit into any kind of analytical engagement with such a society and its healthcare system? One that is so clearly full of discontent and malcontents, discontents of the system and malcontents of those forced to engage it. How does one account for the remainder in the social analysis of the political and the social? conflicts which dominate the public sphere of a place like this, a politics which functions very much like what the Egyptian economist Samir Amin called a marginal periphery in his world systems analysis. And by a marginal periphery, he meant a society in which the elites try and get as much as possible out of the world system for themselves, much to the exclusion of the majority of the people who live in such societies, who will never access the global north's benefits. Is it frivolous or distracting to look at or look for or to account for joy? Or is it part of a necessary political project, not just for the society, but for the knowledge being generated about that society? To ignore the joy, after all, is to ignore a substantial component of what we should know about if we are to understand the system as a whole. One thinks here of Gayatri Chakravarti Spivak, who in a conference once against somebody who was arguing for Holocaust exceptionism, said, yes, the Holocaust happened, but so did the rest of world history. And in here, one wants to say, yes, the corruption, the malfunction, the dysfunction, all of that is happening. But so is the rest of this society's history at the present, and that includes joy. So to go back to that, my description of the bifurcated healthcare system, there is the private and the public, the elite and the precariat. And here I draw on the work of Isabel Laurie, who works in Germany, and in a work on precarity argues that precarity is no longer just a condition, the precariousness of living in uncertain times. Precarity has become a system of governance, a way of understanding the world and ordering the world by the elites, and those elites are both in the public and the private sector. Laurie argues that precarity has become a form of governing in societies that are deeply unstable. And it further destabilizes those societies. She looks mostly at first world or global north societies, but it is important for us to remember that that does not mean that those processes aren't already in place in societies like South Africa, as I said, as Amin called the marginal peripheries. Those divisions between the private and the public, between the elite and the precariat, what do they result in? An exemplary case in South Africa is the Life Esidimeni tragedy. This was a case in which 150 mental health care patients died in state facilities over a few months because the administration prioritized budgets over care. They privatized the provision of care to an outsourced company, the Life Corporation. And in their private care facilities, these people really died the most horrific deaths. This happened in the economic hub of the country, in the wealthiest province of the country, in a part of the country that accounts for up to 16% of the continent's GDP. How does one explain joy? How does one think of joy in relation to such a tragedy? I'll come back to that in a few minutes. What is the consequence of that marginal periphery status of looking at this country through that lens on the politics of healthcare? We've seen it in the corruption, and not just in the pandemic age, though that was certainly worsened in it. We see it in the corruption, not just in the public sector, but in the private sector. This is a country, after all, where the Minister of Health had to resign a few weeks ago precisely because he and his family were implicated in the mischanneling of funds meant to deal or create better communication platforms and communication campaigns around vaccination and healthcare during the pandemic. And instead, 150 million rand went into private pockets, not least the son of the healthcare minister, the health minister, or then health minister. So where the joy and why the joy? The joy we see in those cues, we see it in the people talking to one another, despite having to observe and often over the distance of 2 meters of social and physical distancing. We see it in the social media professions of enjoyment of the process. We see it in what are called millennials in South Africa, anticipating their turn, which finally came on August the 20th. We see it in people posting images of themselves, video footage of themselves getting vaccinated. But this particular joy predates, of course, the pandemic itself. One thinks back to the treatment action campaign activism on HIV/AIDS, and the confirmation of the erotic which came from the talking together to organize, the information that was shared in those lines in clinics and in those in those political protests to government departments for the provision of ARVs. This created a network of activists, but also a social compact between people in societies and in communities that were often precariously situated in relation to the mainstream project of post-apartheid South Africa. But more than just the political organizations and the political gains that may have been made was also the affirmation of humanity for and by people who so easily became reduced to statistics and problems to be solved in the official state gaze. Here one goes back to Isabel Laurie and her notion of the precariat, those dispensable people who can so easily not fit into and become superfluous to the needs of capital in post-millennial post-millennial market-driven thought. They remind us of the apartheid and colonial apartheid notions of surplus people. The life of Sedimeni tragedy certainly demonstrated the idea of surplus people, of people who were left behind and left out of the very important work that needed to be done in order to undo the neglect of apartheid South Africa. That neglect simply continued in post-apartheid South Africa, and over 150 people died as a result. 150 people who, because of their mental health challenges, were often not heard, not listened to, and often couldn't speak their troubles and their anxieties, never mind their joys. But in the harrowing testimony of relatives, of observers, of many people who worked in these facilities that were available to the public on the public broadcaster and streamed on various sites, what came up again and again was the confirmation of humanity, not only for those who had perished so embarrassingly, so humiliatingly, and so distressingly, but consistently for those who survived, their relatives, because in their testimony, they insisted on inserting memories of joy and enjoyment with those who had died and for those who had died. Now, in response to this new pandemic, South Africa, after all, is a survivor of a previous pandemic, the HIV pandemic that hit its KwaZulu-Natal province so harshly, and accounted for well over 350,000 deaths. And having worked in KwaZulu-Natal, I had to teach the orphans, who often were the survivors of these families decimated by, one, the project of colonialism and apartheid and its migrant labor system, and two, the late response to the HIV pandemic and the inadequate response by the late apartheid government and by the early post-apartheid government, a history that Dr. Khalid Pires has traced very well in her work. Much of the South African government response to the crisis continues to be mired in dysfunction and corruption, from the corruption of those governing party officials and senior civil servants benefiting from procurement process perversions, and those in the United Kingdom will be familiar with this, though often with much less distressing, though equally enraging consequences, through the political elites flouting public health protocols, not masking, holding parties, while the poor are held inside their homes by the presence of the South African National Defence Force. And the death of Collins Khoza in Alexandra is only the most spectacular consequence of the violence visited upon the poor, should they flout the rules that the elites flouted so publicly and with so little consequence. That particular form of dysfunction also extended itself to the uncertainty and insecurity around vaccination, and, as I pointed out, the resignation of the trusted health minister in a scandal around misdirected and misused funds. What is the cause for joy? Where is this joy? And how do we see it? Why do we continue to see and hear all this joyful talk in queues and talk about the joy amid the horror of hundreds of thousands of dead and millions affected by the disease and its longer-term consequences? I would argue that this is part of the resilience and defiance. Resilience because South Africans had learned so much from the queuing and the talking of the HIV pandemic, and the sharing not just of useful information, but the reaffirmation of one another's humanity in the face of a system that works as a juggernaut to grind them down, and defiance of that system's attempt to overdetermine their lives. This, I think, is crucial to remember. Those men and women talking in the lines and talking about the lines, sharing which lines are shorter on social media and WhatsApp groups, talking the lines it's themselves as indications of success of their agitation for vaccination. These demonstrate something that is often ignored: joy and enjoyment as resistance, as deeply political processes that are part of the polity rather than remaindered from what it is we look at. And in a healthcare system as bifurcated and mired in problems as South Africa's healthcare system is, it is often difficult to see and look at and take seriously this joy and its profession. We hold the line by looking at the failures. We often ignore stepping out of line to join those other lines of the ordinary, which Njabulani Ndebele urges us to rediscover in 1990, and look at joy and enjoyment as something more than just superficial, as something constitutive of political agency and of people's insistence that they not be treated only as consumers, as statistics, as facts, but as human beings, as something other than the facile kind of efficiency promised by capitalism and the market. If only you get enough to enough people, you will have somehow a stable system. People insist by talking about, talking through, and talking in those lines, a profound registration of themselves as human, as people who matter, as people who enact in their incessant talk a speech act, as Searle would call it, a way of registering their political presence and their politics that matter. Their talk, therefore, is material, and we should pay attention to it. Yes, the talk is made difficult by lockdown protocols, but not impossible, and South Africans have found ways around them. At the end of this talk, I'll show you a brief clip to show you just how far this exuberance and this joy can go. And I would argue that it isn't just a notion of the carnivalesque, for that moment of being in the queue, a suspension of worry and a return to the order that is. But this talk is truly transformative. Without this talk, perhaps South Africa would not have had the vaccination successes that it has so far enjoyed. Without this talk, perhaps we wouldn't have had the reversals of some of the problems we've had with the HIV pandemic. And without this talk, what gains we have had in the healthcare system would not have happened. And certainly without talk, we would not have had the inquest into and subsequent legislative accountability of the Life Esidimeni tragedy, where not only did the former Deputy Chief Justice of the Apex Court of South Africa sit over and in control of a particular judicial inquiry into the deaths of 150 mental health care patients, but has since indicated a legal process that is currently in the court system to hold to account those who sat over those failures. This is not to attempt to suggest that there isn't a struggle that must be fought to understand and address and reverse the challenges and failures of the South African healthcare system. On the contrary, I would suggest that we can do that necessary work while also incorporating people's expressions of joy precisely because they are political in their consequences. Two anecdotes, I think, illustrate part of this. A friend who recently had to have a mastectomy in the Eastern Cape public health system, a public health care system that has been mired in corruption for decades and in failures for as long, has discovered joy in her interactions with other patients under similar treatment, in the surprising efficiency which resulted from the hard work of professionals and from those who deliver these services. Diagnosed in March, she had her operation in June and has been in full care since, and constantly interacting with people from across the spectrum of divisions in that city. For years, she hadn't understood how a former student and later friend could be a clinical psychologist in the dysfunctional system and in the particular hospital in which she then had to get her care. She couldn't because she knew another friend who was a pharmacist and had been relaying the difficulties of procuring the necessary medication and drugs required to deliver a functioning healthcare system in this province at that hospital. But her joy, I think, came from discovering that despite these challenges, people worked hard, and patients and those in the healthcare systems, nurses, administrative staff, came to work with a sense of joy, delivering beyond the call of duty, and often through talk, and often in talk, reaffirmed the humanity of those in the system who both worked as well as those who came to avail themselves of the necessary care. This is often not the public story. The public story is one of uncaring nurses, of overworked nurses, of doctors who complain about the conditions under which they work. What is often lost is the joy that these overworked, underpaid people profess every day and that patients gain from. The second anecdote is my own experiences comparing healthcare in the private and the public sector. And the joy that my friend observed in the Eastern Cape is a joy that I too observed in the private and public healthcare systems of the wealthiest province in Johannesburg, the wealthiest city of the country. The joy between staff overworked over a holiday who have to deal with patients who are demanding in the private healthcare system, who treat it like a supermarket. The garrulity of waiting in emergency rooms to get your broken arm set or to undergo tests to explain internal bleeding, or the short-term hospitalization for surgery, or queuing to get vaccinated at the largest public hospital in South Africa, which had been shut because of a fire that hadn't been put out in time and it caused extensive damage. All these experiences are mixed with the joy of talkative engagement between people that reveals something about what lies beyond the statistics about healthcare provisions and its shortcomings and failures. And this, I think, is something that is often very important to do because of its political consequences, not just for those who come to take the care, but for those who give the care. And it isn't a kind of anodyne attempt to make people feel better about themselves. It is sympathetic and sentimental in the true 18th century sense of the word. It is the fellow feeling shared by human beings in talk that reaffirms the erotic, the life force, and that in a sense often results in the jouissance, that French term, that is more than merely superficial enjoyment. It is the full engagement with human life that is not just about tragedy and loss and the statistics that mark these, but is about the enjoyment that healthcare provision gives those who give it and gives those who get it, a chance for life, but also an experience of expressing their lives. I'd now like to show you a short clip of a group of people going to get their vaccination because they fall in the last group to be given that opportunity in South Africa, people aged between 18 and 35. I'm hoping to be able to share my screen, but if I can't, I will share the video with others who can then put it on for people. So hopefully I will share my screen.
Yes.
So that clip not only shows a young choir from a township of working class people going to get their vaccination in Hillbrow, but the music that they're playing is a song called Uxolo Mandela, which was sung for Nelson Mandela at his very first appearance at the FNB Stadium in Johannesburg, which is used in a documentary about the role of music in the anti-apartheid struggle. And in that sense, there is continuity with lessons learned from before about struggle for and struggle against. And here is a moment in which surplus people who live precarious existences, continue to enforce their talk upon us by refusing to be silent or silenced, and talking in the line, talking on the line, talking over the line, and in that sense, talking a new line. Thank you.
Angelo, thank you so much. As always, an insightful, critical and deeply engaged context and discussion. And I'd like to open up to see if there are any questions. If people could please raise their hands to indicate if they would like to ask a question, or drop questions in the chat, and I can take it from there. While we wait for people to find their questions, I wanted to pick up on your commentaries around precarity, joy, and what joy is and how we found it. And in yesterday's session, some of the questions that came up were exactly around, how does one, on one hand, in a world where there's a kind of obsession for proving the impact of something on people, that when you start talking about things that are more philosophical, emotional in nature, like joy, it's often difficult to make the case for what it is that joy brings, even though in some ways it seems self-evident. So, that then raised questions of, do we pursue ideas of joy in healthcare and what that would look like and how you would measure it, or is that a kind of a chaotic approach? But more than that, how do we conceive of or reimagine the notion of joy as resistance, as absence of sorrow, as abundance of good feelings? So just in terms of the rethinking or redefining or re-engaging with the notions of the concepts of joy and the complexities of that, you've touched on particularly joy as resistance and as an affirmation of the life forces. And I was just wondering, are there other examples that you think of that would help as we go forward with thinking through joy in healthcare to expand our engagements and understandings with joy? We can't hear you.
I think you froze there for a second.
Oh, sorry.
Because I could see Astrid moving, but I couldn't see you moving.
Okay. Sorry, that may be our connection on this end. I'm terribly sorry. So my question was, in a lot of the discussions around the philosophy, or how we conceive of or consider joy in relation to healthcare, that there is both the tension between, the tension between the philosophical notions of joy and the spiritual or kind of conceptual ideas, and yet often in a context where healthcare requires some sort of measurement to prove the joy, and just the tensions of that in terms of discussing joy, but also the questions of what are the ways of examining joys that perhaps we need to pursue if we take the idea of joy in healthcare forward. So you mentioned joy as resistance. Yesterday what came up were discussions around, is joy the absence of sorrow, or is joy something that appears and can only exist in relation to having had sorrow? So are there deficit models? Is it something that is an either or? I just wondered what your thoughts were on taking the ideas or the discussions of joy in healthcare forward, in addition to the very rich suggestions you've made in your talk already.
Do you want to take a round of questions?
Yes, I can do that. Oh, people are being very quiet this morning. I don't see any hands. Would anybody like to?
Can you hear me?
Yes, Astrid, hi.
I haven't really thought this through, so I hope I can articulate it properly. But I was just thinking, I mean, I agree that it's important to look for joy as a form of resistance. But would you think that it would be, would there be a danger in overlooking the struggle as well? And one wouldn't want to gloss over it and try and look for happiness or joy when in fact there's so much struggle and an inadequate healthcare system where people are treated poorly. And I'm not sure if I missed that, but how one wants to also recognize that and at the same time look for joy as a way of joy is an act of resistance, but also at the same time recognizing the inhumane healthcare system that most people experience here. So,
okay, do we have any other questions? Thanks. Thank you, Astrid.
Okay, shall I take those two
take
and then
those
others
two
can
and
formulate
then,
if they need
yeah.
to?
Thank you.
I'll start with Astrid's question and work my way back to yours, Carla. I don't think it's productive for me to oppose joy or to make joy happiness and to oppose it to sorrow. I think that that creates the binary of exclusion, which then says certain forms of expression are legitimately joy because they follow sorrow and others are not because there's no detectable sorrow. I think happiness is so easily and has become so easily commodified in our age. And it becomes, whether it is the alternative to the GDP, the happiness index of Nepal, or whether it is, are you happy with our service? Are you happy with what we've done for you in the healthcare system? Are you happy with the plan? Are you happy with this thing? And happiness is very different for me from joy. And joy is related to enjoyment, but I think it exceeds enjoyment. And here I think through figures like Lacan or Zizek, the joy is an expression of something that is higher than enjoyment. Enjoyment is often momentary. It's often very specifically related to consumption behavior and to processing. Whereas joy is often an expression of emotional content. And I mean that in the double sense of the word content as well as content. And it is, in a sense, far more constitutive of human subjectivity than enjoyment, which says, enjoy these products and you will become human. And therefore, I think its political function in bringing together the struggle and the joy was precisely because people find joy in struggle. For those ordinary people who participated in the TAC struggle for ARVs, antiretroviral drugs, their joy came from the participation in the struggle. And one gets the same sense from watching communities, groups, people participating in agitation, in struggle when things go wrong, that they experience joy in that process. And they sometimes express it as song, and they sometimes express it as dance, and they sometimes express it as talk. And it is the joyful talk, even as people are angry, there is a joy in their anger, which is a confirmation of the erotic in its technical sense of the life force in the face of all this death, in the face of all this dehumanization, in the face of what you point out, Astrid, is the grinding down of the human beings in this juggernaut of an ugly system that denies people all sorts of things. But without that joy, I think there would be a missing out of the human and the humane, and there would simply be a looking at the efficiency of the struggle for the gaining of the right or the service or the delivery. And that leaves blank and leaves out of the gaze the very humane and human expressions of joy, which could become productive of further joy. If we don't look at these joy, of these moments of joy, of these expressions of joy, we often can't account for why it is that we, and how it is we can improve people's experiences of. And here to go back to Carla's through your issue, the question of measurement to me is always fascinating, because I think this is an academic obsession that I no longer share, having stepped away. It's an obsession in the sector I currently work in, which is the NGO sector, because you have to account for what it is you do to grant givers and to accountants. It was an issue inside the media sector where I work, because you have to demonstrate something that people can see as effective. And I think part of what we have to do is rethink measurement in this work, that some things cannot be measured. And this is not said superficially in order to kind of get away from accountability. But I'm going back through people like Steven Weinberg, the physicist, in his work on explanation, who says that there are many things that science can explain, but there are things it cannot explain. It can explain causes and effects, but that doesn't account for the full human experience. And I think it's important for us to continue to hold in our gaze that because we work or live in healthcare provision, not everything is going to be accounted for through accounting systems. And joy is one of those things that late capitalism would love to be able to count, because then it can package it and sell it. This figures in the wellness programs in hospitals that those of us who have any kind of critical engagement often avoid because they're so formulaic. Fill out this questionnaire, engage in this form of play. Here's a little gift in order to encourage you to participate in the system. As a consumer, what's fascinating, and I think this is demonstrated by that little video clip I showed you, was that those people did not behave like consumers. And most of us in healthcare provision do not behave like consumers or like product givers. The system might channel doctors, nurses, orderlies, administrators to behave like those who work in supermarkets or in Amazon warehouses, move patient from point A to point B. But that's not how the human being works. And so the measurement of joy is, I think, an avenue I wouldn't be interested in pursuing, because to me it's a dead end. It's simply reabsorbing the resistant into the dominant. And for me, that's, to quote the Star Trek phenomenon, resistance isn't futile. If the system is going to be Borg-like and measure efficiencies, joy is a defiance of that kind of measurement and that kind of process. It's people who go, we're going to go through this process because it's necessary in order to survive or to take care of a problem we have, but we're refusing to have our joy incorporated into the system, precisely in the way that they defy the rules. You're supposed to wait in an orderly queue 2 meters apart. You come with your brass band and you sing and you dance and you are wearing a costume. You are not supposed to talk to people, but there is constant exchange of information in these queues about which vaccine do they have. And it's irritating if you're not in the mood for this kind of joy, but it's also wonderfully sort of reaffirming when you watch people simply not behaving as they're expected to in the queue. They get out of the queue, they go into the hall to insist, do you still have any Pfizer left? Because I was here last week and they didn't have, they only had J&J, and I don't want J&J, I want Pfizer. And you go, well, you've had the first Pfizer, so you're not going to get the J&J. There's a whole sense of leakiness that the system cannot and wishes to contain but cannot. And joy is that kind of leakage. It seeps out despite attempts to contain it. And this is part of the problem with the system of precarity as governance. If you have a system of governance that requires precarity, you require containment all the time. And the most spectacular systems of containment of human beings have failed in history. Apartheid was a system of containment. The poor have to go in a particular space, the black have to go in a particular space. Didn't work. The Holocaust was a desperate attempt and a vulgar and vile attempt to contain. It doesn't work. And late capitalism is desperate to contain people. And in marginal peripheries like South Africa, the elites would love to contain the majority, whether it is by creating bifurcated healthcare systems or by insisting that we have different kinds of sites of delivery. And people don't. People go to sites because they're close by or because they want to go or because they think it's going to be more efficient. And the idea that you would have a private care system that would deliver vaccination and a public care system that would deliver vaccination, that didn't work out because people refused. People simply went where they wanted to go. The private care systems had to, abolish their attempt to keep it private. Whether they did so in the most securitized neighborhoods on the continent. I mean, there's a medical health insurance company that provides vaccination. They decided to do it at their head office. Their head office is something out of Margaret Atwood's Oryx and Crake. It is the most securocratic phenomenon ever. The writer Cesar Mpofu Welsh, in his latest book, on apartheid and its extensions called The New Apartheid, talks about that part of Johannesburg as, in legislation, it has been enacted as among other things, an urban improvement district and a security. There are private security guards that keep poor people out, that arrest them, that, you know, kind of move them on from the space. And yet, in the heart of that district, this medical insurance company couldn't keep working class and poor people from coming to queue to get vaccinated. And that, I think, is part of the resistance, the expression of joy, people telling one another on social media and on WhatsApp and on various messages, this is the clinic to go to, this is the queue to go and stand in. Don't go to that one, you'll stand there for 4 hours. That kind of information is joyfully, you know, sort of shared. And even when the government system broke down, people said, don't wait for the second SMS, go. And not in a kind of critique of government, but in an expression of joy, of experience. And this, I think, is something that it would be horrible to ignore, but it would be even more horrible to try and measure, because that measurement would reassert the power of capital to commodify and therefore sell people's joy back to themselves, which would get us into what Zizek calls enjoying your symptom as yourself. The very thing that you are using to resist incorporation into biomedical, pharmaceutical, capitalist discourse will become the thing that gets sold back to you. And so I'm not interested in measuring, but I am interested in noting, learning from, and using it in research to account for the full human experience, rather than to ignore it, which risks leaving it out and reducing those people to the very thing that they are resisting: digits, statistics, consumers, and nothing but automatons in a system that, once they can no longer afford or are no longer profit causing, will become truly superfluous, truly surplus, and the remainder excluded.
Excellent. Thank you, Angelo. And much as I would love this conversation to go on for much, much longer, we are trying to stick to time. So I'd like to thank you very much for a thoughtful, insightful, and interesting presentation that helps us frame, think through, and take further the discussions we're having about joy in healthcare. I appreciate particularly the ideas of the joy as resistance, and yes, I think of a big beverage company that kept telling us they could sell us happiness because they were happiness, and that the guarding against the ideas of who we are and how we feel, the reduction of complex emotional human spaces to slogans or to products that can be bought or sold, I think is something we need to hold in our minds as we resist those very efforts to reduce our humanities rather than support our imaginative and creative and fully complex engagements. Thank you very much for your time and for your input.